Analyst Healthcare, IIFL Security Limited, Dr. Sharma has served as the Vice President of HDFC Bank Life Sciences.
We would now like to acknowledge Dr. Harsh Kumar Jha, lecturer at Newcastle University Business School, University of California. He has done his Masters of Science Management Research from the University of Oxford and PhD from University of California. He has received the Ray Watson Dick Doctoral Fellowship from Palmerit School of Business, California. We feel honored to have with us Dr. Rahul Pandey, Operations Officer, Health, Nutrition and Population, the World Bank, New Delhi. He has earned his postgraduate program from our beloved IIHMR University. A very warm welcome to all of you. I would now like to hand over the mic to Dr. Sudarshan Jain to start the panel discussion.
So good afternoon to all of you. Can you make an effort at all your friends who are outside so we can have very full discussion? Maybe if the organizers can make an attempt.
I request all of you to kindly come back.
No one will hear from here.
Yeah, maybe you may have to make an attempt from outside. Okay, good afternoon to all of you, and I request all of you to settle down, concentrate, take away your mobile phones. Some of you who are looking at the mobile phones, please keep it aside. We have got a great advantage today to have a power-packed panel. I do panel discussions almost every week, but it is a great privilege, one, to be here at IIHMR, where I have been associated with this institute for now almost almost a decade. And second, having this outstanding panel. The great advantage of this panel is we have got diverse expertise, diagnostic, pharma, your old alumni, Rahul from the institute, people from healthcare, people from pharma sector, people from education sector. So we will get a lot of diversity in this whole panel discussion. I will begin with some few comments, and right at the outset, I'd like to thank IIHMR for this outstanding theme for this panel discussion and for the theme of the overall conference, that is Future of Healthcare, Globalization, Local Innovation, and You. Very, very important, and this theme is very this theme, and then come to the panel discussion. Like all of you sitting here, I started in the healthcare industry around 35 years back, and India has come a long way in last 35 years. 35 years back, we used to import everything. 80% was imports, 20% we used to manufacture in India. But today, all of us can be proud of the fact here that India is the pharmacy of the world. Our products are available in 205 countries around the world. In US, every third tablet is sold from India. In UK, every fourth tablet is sold from India. And we account for 1/5 of the global pharma market. So in the pharma industry, India has made a big headway. So all of you can be proud of this fact, that all of you are joining the industry which is making difference in the world. And whichever forum in the world, when we go, whether it is WHO, WTO, UN, India is recognized because we have made difference to the lives of millions of patients. There are many patients in the world, whether HIV, cancer patient, they are surviving because of us. So you can be proud of the fact that you are joining the industry which is making a difference to the healthcare in the world. And a great moment, and IIHMR is the premium institution as far as the healthcare is concerned, right? Second point is, as far as hospital sector is concerned, again, we are making tremendous difference. Arvindo Eye Hospital is covered in various publications. Narayan Hridayalaya is covered in various publications. There is concept of reverse innovation, which Professor Vijay Govindarajan has talked about. And again, this institute has published many papers. So again, a moment of great pride for all of us. The focus of this topic is value-based healthcare and tackling price transparency. What I'd like to do, I will briefly set the context of the healthcare industry and then leave it to the panel discussion. Healthcare industry is different compared to the other industry because sickness is an unwanted product. No one plans for sickness. You plan for buying luxury goods, you plan for your holidays, you plan for your housing, but you don't plan for sickness. So it is an unwanted expenditure, unwanted product. And second problem, as far as this product category is concerned, there is asymmetry of information because patient is relying on a doctor to get the service, so he's not totally aware about the product, what he's buying. And both these factors in today's world leads to the trust deficit. Although we are making difference to the lives of the people, but at the end of the day, patient feels whether he's getting the right kind of products or services, and many of the times government feels that is our patient and community is getting the product at the right kind of value. So the biggest challenge is how do we create the trust factor, and how do we talk about value-based healthcare and get transparency in the whole discussion. Now, this is well said, but the question is, Indian context, we have to also take into account what was talked in the inaugural discussion, that out-of-pocket expenditure is very high compared to any other part of the world. 65% is out-of-pocket expenditure. So although it is unplanned, in Indian context, 65% of the patient, or all of us sitting here, we have to pay for our own healthcare expenditure. So it pinches us. So how do you deal with this issue where out-of-patient expenditure is low? Although we are the most cost-efficient producer in the world, the trust factor sometimes lacks. And how do you deal with the question of unplanned expenditure which is there? So these are the big questions when we are dealing with. And I've got an esteemed panel which will get a lot of clarity on this issue. And you can be proud of the fact when you leave this room that you are working for an industry which is making difference, and there's better clarity on some of the issues which are important issues as far as healthcare is concerned. So what I'd like to do is, I'd like to start with Dr. Harsh Jha. He's from Newcastle University, and he will get better clarity on these terminology. What is value, what is price, and what is transparency. So I'll start with our esteemed panel members, Dr. Harsh Jha, and then we'll move forward to get the concept in clarity. And again, if you are not interested, you can go out of the hall. But if you are there, it is a very serious discussion, a lot of relevance for the healthcare, and we have got top global experts who are sitting here, right? So please, I will request you to maintain silence, concentrate on every word which is being said here, right? And please maintain silence. In the corner there, I can see everyone here, right? Can the organizer, someone go there and please maintain silence, concentrate, and no internal discussion, right? Now I request Dr. Harsh Jha to speak on this. Harsh.
Thank you, Dr. Jain. First of all, thank you so much for setting the agenda and boundaries very clearly for everyone, including those who are listening. So, when I read the title of the panel discussion, Value-Based Healthcare and Tackling Price Transparency, I found the title really, really interesting, especially for someone who is not from healthcare background. And I looked at it again and again. I thought, what's the most interesting word here? And I thought from a student perspective, I thought, well, the word tackling is most interesting. You know, it gives us an idea of doing something. There is a problem and we'll solve the problem, and transparency is the problem. I would like you to reread the title, Value-Based Healthcare and Tackling Price Transparency, and kind of look at all these words and think through them again. Because when I did that exercise, 3 words which really jumped up at me were value, price, and transparency. And I'll tell you why. These are the words which seems very obvious. We think we know what they mean, but when we start really challenging our understanding, then we realize 2 of us don't have a common understanding of what that word means. And I'm an organizational sociologist, so you'll have to bear with it. So, for example, if you look at the word price, we all know what price is. Price is something which is an outcome of demand-supply interaction. That's the microeconomics for you. So price is something which market gives you. Obvious, right? But if that is true, what does price mean in an industry which is defined by IPR and patent regime, which gives the producer single access to a huge market with almost no competition? So do demand and supply principles apply there, or they don't? Similarly, if you look at the word value, value is a very value-laden word. So I can ask you, value for whom? Whose value are we talking about? What type of value? Are we talking about financial value, which is specific to the provider? Are we talking about social value, which is specific to communities and state agencies? So you can see there is a serious contradictions or a set of contradictions there. Similarly, if you look at the word transparency, which the last panel indirectly was struggling with in terms of individual transparency of data, I can again ask the question, transparency for whom? And transparency for whom? Who gets to know the details and to what extent, and which details count? So what do we mean by price transparency? Does that mean that all the costs associated with a particular drug, they're going to be known to everyone and then they're going to be a cost plus method of defining a price? Of course, that's not what is happening. So what do we even mean by these words? And this is something I want you to challenge on, because I understand that most of the listeners are students, but probably this is applicable to public policy people too. That all words which we take for granted, they are socio-cultural constructs with multiple, even contradictory meanings associated with them. And when the time for policy changes come, these words are really become contentious words on which people undertake conflict in. So people discuss, what does it really mean? Is our healthcare aim, for example, is coverage or is it quality? Everyone would love to say it's both. If it's both, then what does that mean? How do you achieve both? So as you can see where I'm going, is that one of the most important tasks as students, as analysts for us, is to challenge our fundamental assumptions about what different words mean when different questions are posed to us. That is especially true for public policy questions and social policy questions, because so much depends on those questions. So it's not just about which question is asked, what does that question really mean, or are there apparent contentions within that question? And this is something I would like you to think more about as this panel discussion progresses, and hopefully have some questions for us which challenge our understanding of what we are presenting to you. And we can have a very informed conversation from there on. Thank you.
Thank you very much, Rahul, Dr. Harsh. Now we move over to Mukul Bagga. Great context, and he has raised fundamental question: is coverage more important than quality? And how do we get the balance between coverage, quality? Fundamental question in healthcare: access, affordability, and quality. How do we get the balance as far as the whole structure is concerned? Over to Mukul.
Thank you. A very good afternoon to all of you. Thank you, Dr. Ruchi and IIHMR for inviting me to this panel, Jain Saab for nominating me. It's a great privilege and pleasure to be here with all of you, even though it's a post-lunch session and we don't have the full quorum, but always good to have an interested audience rather than a full audience. So thank you very much for your attention. When I read the topic, I was a little intrigued, because this is not what I have done all my life in terms of diagnostics or pharmaceuticals. But then I think quality is something and value is something, our words, and as we were hearing Dr. Jha mentioning it as well, something which resonate with us in any aspect of life. But in a little more technical context or in the context of healthcare, what we are speaking today, I thought it is a good opportunity for us to maybe, understand this a little better. So, do all of you know or have an idea what the definition of value-based healthcare really means? Anybody would like to make an attempt? Value-based healthcare. Anybody? Okay, so basically, to put it in a very simplistic way, value-based healthcare is when you're trying to measure outcomes. And how do you measure outcomes? You're measuring outcomes by looking at the outcome, and then you're measuring the cost. So outcome divided by cost is equal to value. Now, what is the outcome? You have